I've been asked to do a video about the things that I'm putting in my range bag, specifically medical, first aid, trauma equipment. Before I start this video, I want to make sure you understand I am not a doctor. I'm not a medic. I am not a nurse. In fact, I'm not even a chiropractor. So there's really no significant certification for what I'm telling you. What I'm telling you comes from countless hours of combat first response training, from civilian first response training, and just practice in general. So it's possible that some of the things I'm telling you is not 100% correct. If you're going to use any of these items, I really do suggest you go to somebody who does know, somebody who's certified, and see what they can do to help you. So let's move on. When I go to the camping, by the way, you're going to notice my audio has changed significantly. That's just the nature of this kind of a phone. I'm trying to overcome it, but it's a cell phone. What can I do? I have new equipment coming. It's going to make for much better audio and video in the next couple of weeks, but for today, you're getting what you get. Anyway, so when I go camping, I carry this big guy around. It goes out to camping with me, and that's because I go group camping occasionally, more often than not, and I want to make sure that we have everything we need. It is packed full of yummy goodness. It's got so many things you might need that, you know, we're covered. However, we're not going to talk about that today, so I'm going to throw that guy out of the way. This is my range bag. It is an El Cheapo range bag. Came from Amazon. Right there. Next pack. This thing didn't cost much at all. It is cheap to buy and it is cheap materials. But I'm going to tell you something. It's been to the range 40 or 50 times and it's pretty solid. It is actually doing a really good job of holding together for the price. I mean, if it falls apart next week, I got my money worth. So, you'll notice on here, ouch pouch, front and center on it, right? So to give you an idea, the first thing you want to bring with you when you go to the range, Band-Aids. You gotta have Band-Aids. Band-Aids of all sizes. Now, I always put in my ABD pads. I'm gonna tell you this 1,000 times. ABD pads, they're like tampons for men. If you're bleeding and you need to clean up the mess, these are great for cleaning up the mess. If you've got a massive opening, these are great for closing, well, sealing massive openings. When you're shooting, a lot of things can go wrong, and one of those involves massive openings. Now, we're not going to go through this whole kit today. You don't deserve that. Okay, you do deserve that because you're good YouTubers, but we don't have the time for that. We're going to just go straight to the thing that everybody's asking me about, the blowout kit. So let's move this guy out of the way. Boy, does that weigh a ton. Don't worry, I'm going to do a video on that thing eventually. So when you look at my blowout kit, the first thing you notice, there's a rubber band wrapped around it, and it's visible that it says blowout. Now, it's kind of wearing off because it's been around for a while. But the Ziploc bag makes it real easy for anybody in an emergency situation to jump into my bag and take what they need out of it, right? So they snatch this guy out. They know that this is the blowout kit because, you know, they can see all the stuff inside it, right? They snatch it out. On the very front of it, bam. See that? This is a trash bag, a very large white trash bag. With one hand, I can open it up enough to throw it on the ground and use it to dump all of my stuff on. Now, for the interest of this video, yeah, I put a hole in it just a minute ago. For the interest of this video, I'm going to dump it all on my nice little green thing here. But trust me, when you're out there and there's an emergency and you can put this on the ground and dump everything on it, that keeps it from getting lost in all of this mess. Because you'd be amazed how easy it is to get lost in all that mess. So this is great. Plus, when it's all said and done, you just open this up, throw all your bloody rags and bloody ABD pads into it, tie it up, and take it with you. So it's good for cleaning up the mess. So once you have that apart, snatch that off. We're gonna get silly here and you know, it's good to learn how to open all this with one hand because there's a good chance that in this event you're going to, right? So we open it with my teeth. Here we go. Dump that. That's what's great about the Ziploc. Everything is where everybody can see it without any problem. Sorry about my finger getting in the screen there. Now, let's talk about what's in it. There are some things in here that you seriously need training to use. Among those is this. That is a catheter for needle chest decompression. If your chest is compressed and you can't get air into it and you need to release that compression, that pressurization, you slam that guy in there, that big old needle in there, yank it out and let the air flow. This is something you need training to use. This is not something you just cram into somebody's lungs. This is something you really do need to understand how to use. So don't get it unless you're gonna get training, and don't use it unless you have had training. I've had lots of training. Next, the ever important, pardon me if I've said this before, but ABD pads, extra absorbent. They're good for cleaning up around the mess. They're good for cleaning wounds. They're good for packing wounds. You can't have too many of them, and they compress fairly nicely, but believe me, you open this up and they get pretty big. Another thing you're gonna want, a handy dandy little itty bitty pocket knife. This guy right here is so sharp that I really should keep band-aids glued to it so that when I'm trying to close it and it nicks my finger and makes me bleed, I can just put a band-aid on it, because it's that sharp. I mean, seriously, every time I open it, I swear I bleed. You can imagine all the things that comes in handy for. All right. I threw some rubber gloves into here just to keep them from, getting unknotted and all that. Really, in this circumstance, that's less about sterility for the patient, more about sterility for you, the viewer. And when you're getting somebody else's blood all over you, you never know what those people have been into, especially the shooting community. A lot of you guys are, well, yeah, I know. Strip club much? So the tape here, that's good for everything. I mean, you can imagine all the different things medical tape's good for, holding in the ABD pads or wrapping around things or whatever. It's just good to have, decent quality medical tape. It's good stuff. It's gotten dirty out here, but again, sterility in this sort of a situation where the only goal is to get them from, on the ground to the hospital, that's good enough. So, when we get to this guy, we're gonna need this. If something happens, you need to write down anywhere you can, including on their forehead, what time it happened. So everybody knows how long this person's been bleeding. When the medic gets here, they're gonna ask you questions like that. And if you can talk to the person, sometimes you can talk to them for a few minutes and then blood gets out to the point where they can't respond. You wanna ask them real quickly what their blood type is so they know, and write that next to the time on their forehead. Then start trying to stop the bleeding. If it's dark out, use your handy dandy little light, hang it. You have a little bit of light. It's not great, but you're not gonna have any free hands. And flashlights and batteries die. These last longer in terms of, not having to replace batteries and stuff. So you're bleeding out, it's getting really bad, there's nothing you can do about it. Quick clot, can you read that? That's right, it is a clotting sponge. This isn't for the weak. This is something that if things are super duper bad, you can use this to stop the bleeding. But please don't use it unless it is a matter of dying. For use by trained emergency responders, not average Joes. Be sure you don't crack that open unless their life is just bleeding out in front of you and you have no other options, and it's all you can do. So here's my primary blowout kit. You've probably seen this in another video. Let's get into it. This fella right here. Let's see if we can get that open. Yes, if you can't figure out how to use that, you probably shouldn't be using it. This tourniquet, basically you wrap it around, you cinch it tight with that, and then you crank down on it to really cut that blood off. Now you've cranked down enough when they're screaming their lungs out, because this hurts, and I mean it hurts. Now you notice I have the marker there. You need to make sure you fill out the information that it asks for right here. See that? Time. They need to know what time you did it, what time you opened it up enough for the blood to release for a few seconds, and what time you closed it again. You need to be able to write little all over it, to write in all that information so that the doctors know what has been done with this patient. You don't want them to lose a leg because you didn't write the time. Yanking the bandit, this guy off. Ooh, almost lost it. Shears. These are great for a million things, but in this situation, they're great for getting the clothes out of the way. Blood-soaked clothes are not easy to work around. So you take these and you cut all the clothes right out of the way. Yes, this is all sweat. It's really seriously 110 degrees out here today. So there you go. There's your clothes cutter. Next, the handy dandy emergency bandage. This is a pressure wrap. This guy right here actually shows you how to do it. This pressure wrap allows you to put a really tight wrap around any open wounds so you can stop the bleeding. And that's the most important thing to do, stop the bleeding. Again, we're not trying to heal anybody or fix anybody. We're just trying to get them from your ground in front of you to the hospital. And this could stop the bleeding pretty much anywhere. You can wrap that around the chest, around the face, around the head. You can wrap it wherever you need to. Unlike that, which you don't want to wrap around anybody's head, neck, crotch, any of that stuff. You want to make sure you put things that, you know, give a little around the rest. I like, and I'm weird, they have all kinds of really nice chest seals out there, but I like the Duoderm. I do. I like these. They seem to stick. Seem to stick better for me than anything else I've used. Understand that when you're out there shooting, you're probably going to be, especially in Florida, covered in bug spray, which is oily. You're probably going to be sweating like this, you know, just dripping sweat. So getting something to stick to an open wound is hard. Duoderm does a good job of that. Now, if you have your your sucking chest wound, you would take this thing right here, you'd take it out of the plastic package, that clear plastic package, take that out of there. So now you just have that. Peel the stuff off, cut this plastic to the shape like this, right? And let it hang out so you have that much plastic stuck in there. So you see you have 3 sides closed and 1 side open. Stick it on there, push it onto his chest, right over top of the wound where the wound is underneath the plastic. So as he inhales, this plastic just goes and sticks to the wound, and it allows his chest to expand because it's not letting air out or in. So it allows his chest to expand. And then when he pushes air back out, it lets it bubble out and get all that blood out right there, and it squeezes all that blood and foam and all that weird stuff that comes out when somebody's chest is bleeding like that. That'll all come out here, and then they'll take another breath and it goes, sticks right back to it. So that makes a really good chest vent that will not clog up with coagulated blood. The problem with most of the chest vents you buy is they're only good for a few minutes, and the blood clogs it up so bad that they stop letting air out. This works a little better for that, I think. Again, I'm not a medical professional. I don't do this every day. I haven't ever responded to, you know, traffic injuries and all that stuff. So I'm just talking gunshot wounds and just from the little experience I have with them. So I keep one of those for each side of the chest, because a lot of times if it goes in one side, it comes out the other. So you want two. Another ABD pad, and I think that's it. I really hope that I was able to help you out today with what I've laid out for you as my medical kit. Now, you may want different things in there. I understand. We're all trained differently. We all have different ideas on how to do things. But I do suggest at minimum you do keep some sort of blowout kit in your range bag, because, you know, it doesn't necessarily suggest that you're unsafe, but there are other people there, and sometimes other people do stupid things. I wouldn't do anything stupid, but other people do. So if you enjoy this video, give me a like, give me a subscription. That would be great. And if you want to see more about anything else or any of these things, just let me know. Thanks a lot. You guys take care. I'm making the music for you.